Hi everyone. So today we are going to talk about pharmacological receptors. Now, receptors are something to which a drug attaches and produce action. For example, this is a receptor and this is a drug. Let's imagine it to be beta blocker. This will attach to the receptor like this and it will produce its action. For example, beta blocker decreases the heart rate. Now, the ability of a drug to attach to the receptor depends on its affinity, and the ability of a drug to produce action depends on its intrinsic activity. Based on its intrinsic activity, there are four types of drugs: agonist, partial agonist, reverse agonist, and antagonist. Now, if we make a spectrum of action from minus 1 being the opposite action of the receptor, of the substrate, and plus 1 being the positive action, and 0 being no action, then agonists produce the maximum positive action possible. So that it will have on the spectrum scale, it will have 1. The partial agonist will have produce positive action, but it will not be maximum. It will be sub-maximum. So it will be between 0 to 1. Reverse agonist will produce action opposite to the normal action. So it will be less than 0, which will be negative. And antagonist will have no action. So why do we give antagonists? Now the reason for this is that in body there are multiple forces present. For example, if we take the parasympathetic and sympathetic system, they both act on the body at the same time together. The action produced depends on the balance of the forces in the body. Now, if for example we again take the example of beta blocker, if we give the person beta blocker, then it will block the beta receptors in the body, which will block the sympathetic system. Now, if the sympathetic system is blocked, the parasympathetic system force will be more than the sympathetic system, and as a result, the effect of parasympathetic system will show. For example, the heart rate is decreased. There are four types of receptors present in the body. They are inotropic, enzymatic, intracellular, and G protein coupled receptor. We'll start with inotropic. Now, inotropic receptors are present on the ion gated channels. This is an ion gated channel, and this will be the receptor. Now we'll take the example of GABA. Now the GABA will bind to this inotropic receptor, and it will open the ion gated channel, which will facilitate the entry of chloride ions, and as a result the brain will be depressed. And all the ion gated channels work this way. There are four examples of inotropic receptors in the body. One I've already told you, GABA for chloride channel. Then the other is NMDA, which is for the glutamate channel. The next one is NN receptor, which is for nerve junction, interneuronal junction. And the next is NM receptor, which is between the nerve and muscle junction. These are the only four examples of inotropic receptor in the body. Moving on to enzymatic. In this one, a drug will bind to the receptor here, and it will activate an enzyme inside the cell. The most common enzyme associated with this is tyrosine kinase. Now the drug, after binding to this receptor, will activate this tyrosine kinase and will produce the action accordingly. Again, there are only 5 examples of this in the body. They are interleukin, cytokine, prostaglandin, insulin, and growth hormone. You can remember with this the mnemonic IC pig, as in I see dead people from Sixth Sense. Now moving on, the next one is intracellular. I'm writing with this as IC. Now, as the name suggests, the receptor will be present inside the cell. It could be inside the cytoplasm, or it could be even deeper in the nucleus. Now, the most important thing for this is that the drug which acts through this receptor should be lipid soluble. The reason for that is that only lipid soluble drugs are able to cross the biological membranes. Water soluble drugs will not be able to cross the cell membrane and will not be able to enter the cell, and then again not be able to interact with the receptor. Now, I'm going to first explain the nucleus one. The drug enters inside the cell, then the nucleus, and then acts on the receptor. Now, this receptor, after acting on the receptor, it will affect the replication, then translation, and transcription. So, in short, it is affecting the protein metabolism of the cell. Now, if it's a cytoplasmic one, the steps are similar, just that the first the cell will interact with the receptor in the cytoplasm. This will act inside the nuclear DNA. Sorry. Now, again, there are limited examples of this in the body. For nuclear, it's sex hormones, estrogen, progesterone, testosterone, then vitamin A, then thyroid hormones. For cytoplasmic, it is corticosteroids and vitamin D. You can remember this with a mnemonic. We'll go and watch a movie on a CD on a Saturday night. So SATCD. S stands for sex hormones, A stands for vitamin A, T stands for thyroid hormone, C stands for corticosteroids, and D stands for vitamin D. Now moving on to G protein coupled receptors. Now, G protein coupled receptors are the most common receptor in the body. They constitute more than 99% of the receptors in the body. So, for example, you get a question in your AIPG exam that they give you a drug and ask you which of the following receptor is the drug does the drug work on. So, if the drug is not among those mentioned above in those three examples I gave you, inotropic, enzymatic, and intracellular, then it has to be a G protein coupled receptor. Now, how does a G protein coupled receptor works? Before I tell you, I'll explain you the structure of a G protein. A G protein has three parts: alpha, beta, and gamma. Also, it has a GDP attached to the alpha subunit. Now, when a drug binds to the receptor, it activates this G protein. How does it activate? It allows a phosphate to bind to this GDP and produce a GTP. Now, GTP is a stabilizing force for this G protein, and GTP is an unstabilizing force for G protein. So, as a result, the G protein will split into two parts. One will consist of the beta and gamma, and the other will consist of the alpha and GTP. This unit will produce the action related to the drug. After the action has been performed, this GTP will turn into GDP. How does it do that? This alpha has a GTPase activity. That is, it removes the phosphate, the inorganic phosphate from GTP and converts it into GDP. Once it converts into GDP, it again binds the alpha GDP subunit to beta and gamma, and they form the G protein family again. Now, how do they act? The active alpha and GTP can act by increasing or decreasing the CAMP. It can act through calcium ions, or it can act through ion gated channels. Based on the activity, there are of three types. GS, which is stimulatory and acts by increasing the CAMP. GI, which is inhibitory and acts by decreasing the CAMP. And lastly, GQ, which acts by calcium channels. Now, again, I'll mention it again. All the receptors, other than those involving the three receptor types before I told you before, will have G protein coupled receptor. So again, and one more important thing, the drug does not bind to the G protein, it binds to the receptor, which in turn activates the G protein. I hope you understood this thing, and if you have any doubts, you can ask me in the comments. Thank you.